እንኳን ለስምንተኛው የሀገር አቀፍ የህብረተሰብ ጤና ሳምንት አደረሳችሁ።
Jambo, karibuni kwenye makutano yetu ya miaka 8 ya wiki ya taifa ya afya ya umma.
مرحبا بكم في الاحتفال الثامن بالأسبوع الوطني للصحة العامة.
Bienvenue à notre 8e célébration de la Semaine nationale de la santé publique.
kusoo dhawaada xafladda sideedaad ee toddobaadka caafimaadka dadweynaha qaranka.
Oyei malamu na fete na biso ya 8e semaine ya santé publique.
Rowan Osman, who is a licensed master social work and certified alcohol and drug counselor who has dedicated his career to empowering immigrant and refugee communities. Born in Somalia and raised in a refugee camp in Kenya, Rowan arrived in the US in 2004 and has been making an impact ever since. In 2008, he founded an organization to provide youth programs and support for Somali Bantus in the Lewiston-Auburn area of Maine. As an organization grew, Rowan and his team recognized the need also to educate parents and offer behavioral health services. Today, Maine Immigrant and Refugee Services provide a range of programs and services to support the well-being of immigrant and refugee communities in Maine. With a high school diploma earned through the Job Course program, a bachelor's degree from the University of Maine at Augusta, and a master's of social work from the University of New England, Rowan is a testament to power of education and community building. I want to welcome all of you to helping me welcome our amazing speaker, Rowan Osman, and I will give him the floor to speak to us about mental health.
Good morning, everyone. Thank you, Salam and Hibo and your team for doing this every year. This is something that we need education and awareness, not only mental health, but also public health in general. So my name is Rowan Osman, as I was introduced. I'm originally from Somalia, lived in refugee camps for a long time, and turning 20 in America next year. So I've been here for 19 years. And today I want to talk to you about, I'm going to be sharing a slide and then we'll go over some of the points that, let me see if I can share here. Let's see. Again, that's my name. I'm with Maine Immigrant and Refugee Services. I am the co-founder and also executive director of Maine Immigrant and Refugee Services. I am also, as mentioned earlier, a licensed master social work and also certified alcohol and drug counselor. And today, again, our topic is understanding mental health within immigrant and refugee communities. Let me see if I can. So, but before we talk about mental health, let's talk about the experiences where mental health is coming from, especially for the people that we work with in new Mainers. And at any time, if you have any question, please let me know. Or if you want to raise your hand, I can answer any questions. I want to talk about experiences and how when we talk about mental health, we also need to talk about, especially with the new Mainers or the immigrant and refugees who are here, and some of the experiences they had and how that is related to mental health services programs. So experiences, again, a lot of the people that we work in here have been in a refugee camp. A refugee, again, I will explain what that is in a minute. A lot of, especially a lot of people from Somalia and other countries have lived outside of the country, not in the USA, but outside country as a refugee for over decades. Some people lived there for 20 years, 30 years. And in a refugee camp, again, the life is very limited, very difficult, and that in itself is a trauma. And a lot of these refugees left their country because of a civil war or something going on in their country. That's why they could not live in their own country, and that's why they have lived. And some people still live in a refugee camp. To define what refugee is, again, a refugee is, especially if you're going to be working with new mainers, you need to know the differences so that you can better support and help them in terms of mental health. Refugee is someone who is not a US citizen and also who cannot return to his or her country and has a well-founded fear of persecution due to nationality, political opinion, members of particular or social group. Again, refugee status is normally always given before people come to the United States. So that means they go through all the processes in a refugee camp, they get the approval for everything in a refugee camp. By the time they come here, they are well screened, they have all the documents they need to start working. As a refugee when they come here. So an immigrant is also another one that also, again, if you're going to be working with the new mainers, you will also see a lot of immigrants these days in our state. Immigrants can be someone who left their country willingly. They came here for whatever reasons, and they decide to stay here and never come back to their country, go back to their country. And they can apply for asylum or other immigration benefits as an immigrant. So they came here legally, they come through the airplane, they were screened by border protection and all, through the airport, and that's how they came in here. And then for whatever reason, they might decide to stay here for employment or again, fear of going back to their home country. And the other influxes, the other things that we are seeing, again, for the last couple of years, is a lot of asylum seekers coming in. Again, asylum seekers, sometimes they might come here as an immigrant legally, and then they decide to, again, to apply for asylum. Or they can come through the border, which we are seeing a lot these days. So what is the commonality? So what is the things that unites these three groups that are coming into this country that we're working with? Most of them have a lot of traumatic experiences. Again, they left their country or something is going on in their country. That includes a civil war, that includes a political or even a religious persecution that is going on. That is why they left their home country. That's why they lived in a refugee camp or came through the border. And the life coming to America through the border is also in itself is a traumatic experience because a lot of them had to walk days. A lot of them had to go through a lot before even they came to the border. And a lot of them, again, almost all of them or all of them have fear of going back to their home country for whatever reasons. Again, people are here. These are some of the things that commonalities they all have. They cannot go back to their home country. Again, still the civil war is still going on, or there is still religious or political issues going on in their home country. So these are some of the things that, again, when it comes to mental health, or if you're working with immigrant and refugee population, that you need to understand how did this person come in here? We didn't just show up here for no reason. Again, as introduced earlier, I have lived in a refugee camp for more than 10 years. I have my experiences in a refugee camp. I have experiences back home in my home country, the civil war, and also a lot of the communities that we work with, a lot of the people that we work with, especially the adults, went through a lot in their country. They have seen the death or the killings of their loved ones. They have seen the rape sometimes to themselves or to family members. A lot of them lost their belongings. They took all their, whoever has a power took all their belongings. And again, that's one of the reasons why they left their home country, they left their whole farms or even houses or even everything they had to come to a refugee camp. That is not a choice. That is a survival. And that's why they came in to a refugee camp, or they came all the way from their country through the border to come here, or they came here and then they decided not to go back because they have a fear if they go back, they will be killed or persecuted. And again, that in itself has traumatic experiences itself. So again, those are some of the commonalities that I talked about, some of the immigrants, refugees, and also the asylum seekers share. And again, everyone has a unique story. So coming from Somalia or coming from Ethiopia or coming from any other country doesn't mean that we share the same story. And as a providers, or even as a community member, or even as people who are working in an organization, we need to understand that people have a unique story. Even we might have lived in the same country, we might came from the same country, we might came from the same place, or even have the same religion, but our story is unique, our experiences are unique. Unless you have that understanding, whenever you're working with communities, it's going to be hard for, especially addressing mental health, is going to be difficult for a provider to work with new maintenance. Again, there are a lot of barriers to mental health when it comes to the new maintenance, and the number one thing is the concept of mental health versus immigrant and refugee. Again, depending on the country, for example, where I came from, or Somalia, mental health sometimes it's not something that well understood. It's not something that is well versed in our community. Even we don't even have some of the terminologies that are available in mental health in our language. Sometimes we have to explain some of the terms, and that's how some of the cultures are. Even the concept of counseling is something that is new to us in here. The concept of medication, medication to mental health is something that, again, new to us. For us back home, when someone has a mental illness, like it's visible, everybody sees. An example, someone might have a psychotic episode or might have a psychosis, that everybody can see that. So that's when people will say, oh, he or she has mental health issues. And then even at that time, getting support to those individuals is limited into some countries. For example, medications, for example, counseling is not something that is utilized. And some of those individuals in those countries, again, I'm talking about my own country, Somalia, some of them are chained into a tree so that they don't harm other people, so that they don't do something harm to others. And that's how mental health, some countries are viewed. So again, as a provider or someone who's in working in a community, we need to understand some of those concepts and how your client or the individuals you're working view even mental health. And that will require, and we'll talk about some tips, that will require a lot of education, a lot of awareness. And that's one of the things that HIBO and all the community-based organizations are doing to kind of reduce this stigma. The next one is stigma and view of mental health. And stigma is something, sometimes if you're getting mental health services, some people, and not a lot of them, might view you as you don't have enough faith to your God or whatever you believe. And that can be a barrier too, because if the person is viewed, like if you're going for counseling, if you're getting support, like that means you don't trust your God. That means you don't, and if they believe God, if they and I'm again, most of them talking about within our own culture. So that in itself is a stigma, and also a stigma of being labeled. Is a big thing when it comes to a mental health. I know stigma is available in every community, even within the American community, but it's even harder and difficult when people don't understand the benefit of mental health services, the benefit of counseling, the benefit of medication. The trust and lack of culturally and linguistic appropriate services. And again, a lot of providers have the heart, they want to do the work, but if you don't build trust, and we'll talk about trust in a few minutes, but if you don't build a trust, and if you don't have a culturally and linguistically appropriate services, you will be doing more harm. The mental health services, mental health program is not like a social services. This is a totally different thing. And unless you are ready, unless you're supporting these families, or individuals, unless you have the culture and language available, you might even be doing more harm to these clients than you think you're doing good. So again, if you are an organization, or if you are an individual working with new mainers, this is something that you need to be aware of. Fear. Again, depending on how individuals come in, we all have a fear. For example, myself, an example, before I came here, we went through a lot of orientation. They tell you a lot of things about America, including taking your children, domestic violence. That's something that they emphasize a lot. And one of the biggest fear is if you do something or if you say something, you might lose one of your child, you might lose even all your children. And that is the fear we have. And that's one of the reasons why a lot of new mainers don't want to invite therapists who are mostly, again, not immigrant and refugees into their homes, because they don't want to see something so that they report it to DHHS and they don't want to lose that. Again, they don't want to go through that. And that's one of the fears that people have, and we have seen that. The other one is the stressors and re-traumatization. So stressors. So coming here, we have a lot of responsibility, or a lot of the new mainers have a lot of responsibility, regardless of where they came from. And that responsibility includes taking care of the children here, taking care of the families here, but on top of that, taking care of the families back home. You might be doing a session with a family, you might be doing a session with an individual, but they might be getting 5, 10 calls from back home, and you don't know what those phone calls are. It can be the same situation that these families are here. It can be someone is being kidnapped, someone is being killed, someone is going through the same thing these families who are here are going through. That in itself causes re-traumatization. That even in itself causes reliving the experiences they had 20 years, 50 years ago, because they have a family member back home who is calling them and telling them this thing is still happening. So again, those are some of the things that they don't want to deal with it, and when it comes to getting services or mental health. The other reason, again, I have it here is alternatives. And this is also something that, again, as a provider, you need to know. Before, again, depending on what culture or what country they came, some people have other alternatives to services, other alternatives to get treatment than the Western culture view. Before I go to a doctor, before I go to a therapist or seek services, I might try other options. And as a provider, we need to be aware of those options. There are traditional healers in this community. Some of providers might know, some providers might not know. So as an organization, also or as a provider, we need to be aware of those alternatives that families can utilize. As long as it is not harmful, it is not our job to get involved with it. If they want to do it, if that helps them deal with what they're going, then that's fine. But we need to be aware of those alternatives that families are or individuals are utilizing or are using it within their communities. Okay. Relationship. I know, especially mental health, it is all about bailables. It is all about getting the hours and all those things. I understand that, but within the immigrant and refugee, relationship is the most important thing. Before even you start services, you need to build a relationship, not only with that individual, but with the whole family. If you are working with one of my child, you're working with the whole family. And that's a concept that as you kind of causes of and also the healing processes. And those are some of the things that will help you even develop some of the goals or some of the things that you need to work with this individual and their beliefs about that. Use cultural brokers or trained interpreters. Again, this is mental health. Direct, like a lot of interpreters are trained to interpret word by word. Sometimes that doesn't work for mental health. If you say PTSD, there is no word for PTSD in itself in some cultures. So someone has to explain that. And that's where cultural broker comes in, where they educate you as a provider about that culture. And also they also educate or their clients too about mental health. So make sure you don't use family members, don't use someone that the client doesn't trust or doesn't believe in. And also the other very important thing about interpreters or even cultural brokers is make sure you know who you're using. There are a lot of history in each community or in each culture. If you bring someone into my house who, it doesn't matter if he's Somali or if he's from my country, if that person, if I view or if I see that person as someone who did, or his people, or is someone who looks like him, did harm to my family or are doing harm to my family back home, I will not be open to you. I will not tell you anything. So you have to be careful about those small differences whenever you're working with interpreters, especially within mental health, because that in itself, again, is might cause some trauma or traumatization for the client. Again, be aware of unexpressed depression, anxiety, or PTSD, post-traumatic stress. Again, those are some of the things that you also need to be aware of. Sometimes they might not say that, but you as a professional, you might pick up, and that's when you can ask more questions and more follow-up questions. Be aware of sensitive issues. As I mentioned, this is very important for you to know the culture of your client. That sometimes even the differences within that culture. There are some things that if you bring, people might not be open to you. An example, FGM is one of the things. The other one is tribalism or tribes. So some people don't want to talk about that. They dealt with that back home and they don't want to deal with that. And that's when I was talking about interpreters is that might come into play who use them for an interpreter. And that's why I always ask the client or that family who they use as an interpreter. Don't just bring your own one to the house. Involve parents or other family members, especially if you're working with the family or if you're developing treatment plan or a service plan. Involve, because if you're working with a child, you're working with the whole family, as we talked about. If there is a wife and husband, again, see if you can involve all of them into the work you do. Because if you're working with the wife, if you're working with the husband, and you leave the other one, that might not work well, especially in some cultures. So again, be aware of that dynamics in each culture. Provide materials orally. Again, a lot of us are uneducated in our community. They cannot read and write, even in their own language. I have seen a lot of providers trying hard to translate Somali. I cannot even read Somali, the Somali that they're translating. So don't provide any translations. Provide videos. Provide small drawings to videos in a language that they understand orally. Or so those are some of the ways that you can read. But if you say these are the papers, it says in your language, that is not going to help. Some people cannot read and write even in their own language. Again, the last that one is also prayer. Again, know your client's culture and beliefs. That goes back into the second one. If you have a Muslim client, be aware of their prayer times. Be aware of if you have an office, make sure you have a prayer room. So that you accommodate. That shows that you're caring and you're showing, and again, that shows that also creates a welcoming and also building a relationship with not only with the client but also with that community. Engagement, again, I talked about this. Engagement and trust building is more important than service delivery. For us, trust is the most important thing. If I trust you, I trust you. If I don't trust you, then no matter how hard you try, no matter how experienced you are, if there is no trust, there is nothing your service can do at all. And that's is very important, especially when providing mental health services. Your realization of family strength will produce much more better outcome than one-sided treatment. Again, we talked about this one. Again, family strength, you need to know work with the families, and I will talk about cultural ground in a minute. Family strength, there are a lot of resiliences, a lot of strength within the families that you're working with, especially within immigrants and refugees. They went through a lot. More than you, if you were born here and a therapist or a counselor. So they went through a lot. They have a lot of experience. They have a lot of strength. Use their strength to build a treatment plan, or to build not just this is what the plan I have for you. We will do this one for you from my side. So it has to be collaborative work. Approaching the family problems holistically, again, rather than dealing with the individual client. Again, I talked about that, and I have seen this one in experience where if you're only saying that Menke is only paying one child, I cannot work with the whole family, you're going to lose that family the next day. So make sure, even if you cannot work, be resourceful, connect them with other resources, connect them with other services. I cannot do this one, but I'm going to connect you with Hibo who does this one. I'm going to connect you with Talem who does this. So that way they have a lot of people working with them. Provide acculturation services in the areas of education, legal, housing, and immigration for the family. Again, Make sure that you educate them about education. Again, education, we know the importance of education. We understand the importance of education. We want to educate our children, but understanding how the education system works is something that as a provider, we need to educate our family, our people. Legal can be a lot of things. One can be that can impact their immigration. For example, if they're not a US citizen, if they're getting in trouble, they might be deported. Those are some of the things that you can provide. Education, housing is another one that again, you can provide. A lot of people never lived in the apartment, never lived in houses or places. Some of them might not even might not be familiar with some of the housing rules or others. So that's what some of the education that you can provide. Some of the stuff, again, I talked about it, might not be comfortable with discussing tribe or clans. Again, depending on the country, some people might not feel comfortable with tribe or clans, but people know each other. I'm telling you, if someone comes in here, I know who he is, I know who she is. That's how the community and your client is. If you bring someone, they know who they are. And if that person or anybody who looks that person did something to them back home, that brings, again, the trauma. And that's why it's very important to always ask your clients what kind of interpreters they use. And I have seen clients saying that I don't want to use in person, I want to use the phone line. I want to use so and so. So again, be mindful and be careful about those ones. Again, always provide always provide an appropriate interpretation whenever, again, and wherever necessary. Again, don't use your family members or friends to interpret for your clients, especially mental health. Again, use cultural gram. Again, to know about your client. So what that helps you know about the client. It will tell you the length of the time in this community. For example, how long have you lived in a community? Reasons you came to America, age and time, when did you come to America? What languages do you speak? What do you believe about health? What causes health? What do you believe about mental health? Well, pregnancy, childbirth, those are, if you use the cultural gram, it will tell you all about the family. And that will help you, one, build a relationship, two, create a plan that will help the client that you're working with. Again, we talked about that, provide acculturation and resources, resource navigation services by connecting families to other service providers. Again, if you cannot do the services, just connect them with resources and services that are available in the community so that clients can get support and help. Evil eye is something, and I've seen this one. I didn't even know, I thought it was only the Somalis, but I've seen this, it's available for some cultures. Evil eye is something, again, if you are a provider or if you are a community member, be careful about the cultures. Again, that's why you need to know about the cultures you're working with. Evil eye is something that people take it seriously. And then I will give you a story. I had an asylum interview a couple of weeks ago, and then I had a family, and and then they had a young, like 2 years old girl who was there, and then someone came in and said them, "Oh, you're beautiful." A minute later, that child fell off the chair and then injured herself in the asylum office. And then the father and the mother said, "Oh, they give my child an evil eye." And I was surprised. I thought that was only Somali. But again, you will never know what culture, what cultures believe. That's why you need to know all this stuff. Again, calling a child a chappy, or even your child looks beautiful. Some people might see that as you're giving your child the children an evil eye, and it's something that, again, seriously taken by some cultures and very serious. And I've seen clients changing providers because of just that one. Your child is beautiful and the child gets sick when they get home. So be careful about those ones, especially the new people, especially the new minors that you're going to be working with. Okay, I think I'm almost done. Thank you. That's my contact if you have any questions, and that's my email. And I think I will open up question. And if you are interested, tomorrow we lucky to have Dr. Saida joining us. Again, if you're not already registered, you can go and register that. She's going to be mostly focusing about how we can help our immigrant and refugee youth. As we all know, we are struggling, communities struggling with our young generation because of parents and the kids are kind of like living in a different culture where the father or the parents cannot even read and write their own language. The children are speaking different language. So we're trying to find a way to kind of provide education and support, not only to the communities, but also to the providers. So if you are available tomorrow, you can join us, and that is the email that you have. And that's